Assalamu alaikum everyone. Welcome to my YouTube channel Medibil Pro. I hope you guys will be fun and doing great and of course enjoying your good lives. So today we are going to continue our session of denials management. Okay, so we are going to discuss the denial number 2, that is going to be the coverage terminated prior to the date of service. Yes, so we will discuss this kind of a CO-22 or CO-24 or CO-26 denial in today's lecture. We will see what are the basic definitions, what is the basic, what are the reasons behind this kind of a denial due to which we just have this kind of a denial on file, and also what are the basic methods or basic techniques to resolve this kind of a denial. So we will discuss this kind of a denial in today's lecture. So let's see what kind of a things do we have to fix this one in today's lecture. So first of all, the introduction to the denial. What is the definition of this one? This denial occurs when an insurance claim is submitted for the date of service that falls after the patient's insurance coverage is ended. Yes, you guys just submitted the claim and insurance company found that the member is not active on the date of service. The member was terminated before that specific date of service. So that is the main reason insurance company is not going to process or adjudicate that claim, because they need to deny that claim because the member is no more active with them. So how can they just process that claim? So denial codes, what could the denial codes? They can just refer on that kind of a EOB or ERA, that is CO-22, that this care may be covered by another payer per coordination of benefits. Yes, you can say that because the member is no more active with the specific insurance company, so this care may be covered by another kind of a payer, so you guys can receive this kind of a denial. Okay, next is CO-24. Charges are covered under a capitation agreement managed care plan. Yes, the provider basically has different kind of a like managed care plan. Okay, or you guys can say that the member is going to have different kind of a plans. Okay, so in those kind of a plans, this kind of a service is not going to be covered under that kind of agreement. So due to that kind of reason, you guys can have this one denial. So CO-26, expenses incurred after coverage terminated. So whenever you just guys submit the claim, the member was no more active with that kind of an insurance company. So insurance company will not process that claim or pay for the services that were rendered by a healthcare provider. So these are the basic kind of a denial codes you may receive in EOBs and ERAs. So what are the common causes of this denial? So let's see these kind of a things. So patient's policy was terminated before the termination date. Okay, yes, means member was basically was terminated for that kind of like his or her, you can say that the insurance policy was terminated. Okay, so due to this kind of a reason, you guys can have this kind of a denial. Provider did not verify active coverage before services were rendered. Yes, you guys know that whenever we are working in a medical billing company, we guys need to focus on the eligibility of the member. So we need to find out that the member is active on that specific date of service or not. And if medical billing companies are not going to verify the eligibility on a specific date, then we can have this kind of a denial. So this may reason for that kind of a denial. Insurance plan changed or expired, but the provider billed the old plan. Yes, you can see that the member's plan was changed, so the member just the insurance company is not going to process that claim because the plan was changed. Okay, so due to this kind of reason, the insurance company may not process that claim or adjudicate that claim. Retroactive termination of coverage due to non-payment of premium. Yeah, so due to this kind of a retroactive termination, so we guys can also have this kind of a denial as well on the file. Next one is incorrect insurance information in the system. Example given is incorrect member ID or payer details. Yes, sometimes we are going to have a like incorrect information from the provider. So due to this kind of a reason, we always need to verify the member's eligibility. We need to find out who is the correct payer, what is the correct ID. Then we need to find out the eligibility through portals, through calls, or through different kind of other things I have already mentioned in previous lectures as well. So you guys need to find out what are the basic and best methods through which you guys can just find out the eligibility verification. So you can just watch that lecture too. Okay, and so basically we are just looking for the eligibility verification. So you guys need to verify the patient's eligibility before that kind of submitting the claim to an insurance company. So if you have just submitted the claim without verifying the patient's eligibility, then these kind of things happen. You guys are going to have this kind of a denial on file. So what are the best practices to prevent the denial? So let's see. Prior insurance verification. As I already mentioned, that you guys need to verify the patient's insurance coverage and benefits before every visit using. Okay, so whenever a patient is going to visit a healthcare provider, the insurance staff or the receptionist need to find out the active insurance company name, active insurance company ID, and the effective dates as well. So on every visit, we guys need to find out who is the current and primary payer for that kind of a member, so we can submit the claim to the correct insurance with correct ID. Okay, next, insurance web portals, availability, Navinet, payer specific portals. We guys need to verify the patient's eligibility through these kind of portals. Yes, on availability, you guys can find out many insurance plans eligibility, like Medicare, Medicaid, or and you guys can say that many other kind of insurance company like the private payers as well. So you guys can just verify the insurance eligibility verification over availability. Next is calling insurance companies for real-time updates using electronic eligibility verification. Yes, we guys can just find out the eligibility verification when we are just going to make calls to insurance company, and also we can just use electronic eligibility verification as well. Like our medical billing softwares are also integrated with the insurance database, so we can just basically verify the insurance eligibility as well while using our medical billing softwares. Next one is check effective and termination dates. Yes, ensure the patient's coverage is active for the service date. If the policy is terminated, inform the patient before rendering services. Yes, whenever we are going to submit the claim to an insurance company, we need to verify if the patient is active or not. So if the patient is terminated or patient has no more active plans with the insurance company, then we need to let the patient know that you are not basically active with that kind of insurance company. So you should be providing us the active insurance company name, so we can just submit the claim to an insurance company. So we need to basically verify these kind of things too. Next is update the patient's demographic regularly. Yes, confirm the correct insurance details at each visit. Educate front desk staff to capture insurance changes. Yes, whenever there is a change, like the member has changed their insurance company, or they have changed their plans, benefits, or any other kind of information regarding especially the insurance, then the front desk staff needs to verify all that kind of stuff and capture all that kind of information, so we can just pass that kind of information to the medical billing staff, and then the medical billing staff can just verify the eligibility on the specific date of service. Use coordination of benefits. Yes, check if the another active policy covers the patient. Ask the patient for secondary insurance if the primary is inactive. Yes, whenever there are multiple insurance plans for that kind of a specific member, so we need to get the information of all those kind of insurance companies. Okay, so if the member has like multiple insurance companies or multiple insurance plans, then we need to know that if there is a primary or secondary insurance, and we need to get all that kind of information from that kind of a patient. Okay, so now we are just going to see that what are the 5 basic steps to resolve the denial. So we have different kind of things in scenario based. So let's see. The first scenario is patient has a new insurance plan, or you can say the new insurance company. So what would be the solution to this one? Obtain updated insurance details from the patient, verify the new plan's coverage and network status, submit a corrected claim to the appropriate insurance. Okay, so when there is a new insurance company, like the member was basically inactive on that specific date of service in insurance company, then we need to basically call that kind of a patient like, hey, can you please let us know what is your basic insurance active plan or insurance company, so we can submit a claim to an insurance company who is going to cover these kind of benefits. Okay, so then the patient has a new insurance company, then we can just get the information directly from the patient, and we can just update that in our medical billing software, and then we can just resubmit the corrected claim, or you can say the original claim basically, to the active insurance company. Next, scenario 2 is patient's insurance was terminated in error. Yes, this could be an error on the insurance side, that they may have terminated that kind of patient, but the patient is actually active. So what is the solution? Contact the insurance provider and request the reinstatement verification. Okay, so we need to verify and we need to request the insurance company that they need to find out if the patient is active with them or not. If they have just terminated that kind of a patient in an error, they need to just rectify that kind of issue. And if the payer confirms an error, request claim reprocessing, then we can ask them, we can request them to reprocess the claim and pay for the services that were rendered by our healthcare provider. Next is scenario number 3. Patient was unaware of the policy termination. Yes, sometimes patient is unaware that their insurance company, like you can say that their policy was terminated. So we need to let them know that you are terminated. This was your effective date from this date to that date. So you are no more active with this kind of insurance company. So if you have any other kind of insurance company plan active, you can let us know so we can submit the claim to that kind of insurance company. So inform the patient and provide payment options. Guide the patient to appeal with their insurance if applicable. Yes, we can submit the appeal as well. Okay, so these kind of solutions can be very helpful while resolving this kind of a error. Scenario number 4 is patient had a lapse in coverage. Yes, sometimes there is a, like you guys can say that the member was active for 2 to 3 months and there was a lapse and the member was inactive. Then the member was again active with that kind of insurance company. So there was a lapse basically between that kind of a coverage dates. So if the patient is going to get those kind of a services when the patient was not active, then insurance company cannot pay for those kind of a services. So if the coverage was lost due to non-payment, the patient may need to pay out of pocket. Okay, so patient will be responsible for the services when the patient was basically not active with the insurance company. Offer the payment plans or financial assistance if available. So we can let the patient know that you guys can just pay your dues with these kind of installment plans or any other insure payment plans. Okay, so we basically need to guide the member. The last one scenario is going to be that coverage ended, but secondary insurance exists. Yes, what should be that kind of a situation, like the primary insurance is not going to cover those kind of services because the member is not active with the primary insurance, but the member has secondary insurance as well. So what should be the solution? Build the secondary insurance and adjust the patient's responsibility accordingly. Okay, so these were the 5 best methods or solutions you guys can just use whenever you are going to have that kind of a denial, like the member is basically no more active with that kind of a insurance company, like CO-22, CO-24 or CO-26. So what should be the summary of this one and key takeaways? Verify insurance before every service. Okay, so whenever you are going to submit the claim, you guys need to verify if the patient is active on specific date of service. Okay, check coverage effective and termination dates, educate front desk and billing staff on insurance verification, resolve denials by correcting claim details or submitting appeals, offer alternative payment solutions for uninsured patients. Okay, so these were the basically kind of a summary, or you guys can say the takeaways are the key points which you have to keep in mind whenever you are going to submit the claim to an insurance company. Okay, so thank you so much. A big thanks for your attention. So if you guys have any questions regarding today's lecture, today's denial, and if you don't understand any kind of a thing in today's lecture, then you guys can let me know. I will get back to you as soon as possible. So inshallah, we'll meet in the next lecture with different kind of a stuff in medical billing. So till then, take care of yourself and of your family. And don't forget to remember me in your kind prayers. Take care. Allah Hafiz. Goodbye.